Hello and welcome to the GRACE podcast series. My name is Denise Brock and I'm the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast, members of the GRACE Board of Directors, Dr. Jack West, Dr. Jared Weiss, and Dr. Ben Levy all sat down in their respective homes to have a candid discussion regarding COVID-19 and how it affects primarily cancer patients. In this 4-part series, the doctors discuss testing, risk, preventive measures, ongoing cancer treatment, and many other issues relating to a cancer diagnosis in the middle of the pandemic. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Let's turn to the question of prevention. Everyone obviously wants to minimize their risk. That makes sense. We have talked recently about telemedicine and social distancing as a way to reduce exposure. But there are debates out there. If you turn on the television, one is, what is the value of wearing a mask, and is that helpful? Maybe we could, I'll say that what I think we're getting as a converging answer to that is it helps reduce the risk of infection in other people around you from droplets, whether it's normal speaking and breathing or coughing or sneezing, but not particularly to reduce your risk of being exposed. So it's really a communal risk reduction for the people around you. But it's becoming the rule of the land to do that, to reduce risk to the whole community. Any other thoughts on that point?
Yeah, just say quickly to remember, I think you're right. Masks help, not for the person wearing the mask in terms of receiving potential droplets, but perhaps infecting other people. But we should continue to, there's been some issues, at least in our area of the country within DC and Baltimore, people wearing masks, but forgetting about social distancing and the importance still of wearing a mask. And at the same time, a mask doesn't eliminate the risk altogether, and we still need to maintain social distancing. And we, as an enterprise, have encouraged, obviously, all healthcare workers to wear masks, and now patients to wear masks when they're here, and to patients to wear them properly, and healthcare workers to wear them properly as well.
One other point that I've heard raised is that if you're wearing a mask, it does serve as a reminder and a deterrent to touching your face, which is another potential risk. So just to the extent that we need to modify our behaviors, it's very easy to fall to that, just to scratch your beard or your nose or something, but that we should try to do that as minimally as possible. Another issue is around supplements or particular diets. Is there anything that people should eat or not eat to reduce that risk? And to my knowledge, the answer is no to all of those.
No.
Okay. Good to know. I think that's a quick, short answer, that there's no evidence that any of these makes a difference. And also about contact with other people, family, particularly with younger people who have, the grandkids they want to interact with, and how much of a concern is that? Obviously, there's a lot that we're going to be processing about the impact of social distancing, but particularly when people are in their homes for weeks on end, how much of a risk is it to see family and friends, and how important is it to minimize that?
Children are dirty, Jack. I don't, it's been a while since yours were small, but they're adorable vectors that we're genetically programmed to love. They don't, social distancing is not a thing for them. Not touching is not a thing. Not putting your fingers in someone else's mouth is not a thing. So, it's an awful thing to say. I wish it weren't true. I wish I could tell my patients it's totally safe to see your grandchildren, because I know that's such a huge part of life. All the jokes aside, I do love my children. What's that?
And their support during,
Absolutely. Absolutely. They're the purpose of being alive. They're the support. They're joyful. But it's not safe. I wish the answer were something different. It just isn't.
And Ben, do you have a less misanthropic view, or?
No, I've really, it's just unclear given how asymptomatic this may be with kids.
Right.
I've made a lot of my patients angry by saying, look, it's not a great idea for what it's worth, we ended up paying a nanny to come take care of our kid, rather than have our in-laws come in for that very reason with our 2-year-old. So I think the risk is there. I wish we knew the actual risk. I just don't think it's a good idea.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly, Novartis, Takeda, AstraZeneca, and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.